And so, Scotland prepares to go beyond level 0 next week as pubs and clubs reopen. 500 days since it all began in Scotland, First Minister Nicola Sturgeon is removing almost all of the coronavirus restrictions. The big day is Monday, the 9th of August. That much sought-after moment when we emerge from the tunnel of terror that has encased us since the 23rd of March 2020 has arrived. But be steady as you go, for this is not a declaration of freedom or of victory over COVID. Parliament has been recalled for the second time this summer. Our coverage begins with words from First Minister Nicola Sturgeon.
Presiding Officer, it is the combination of the steady decline in cases, the success of vaccination helping to weaken the link between cases and serious illness, and of course our understanding of the social, health and economic harms that continued restrictions cause, all underpinned by our obligation to ensure that any restrictions that remain in place are lawful, in other words, that they are both necessary and proportionate, that forms the basis for our decision today to move beyond level 0. The move beyond level 0 will entail the lifting of most of the remaining legally imposed restrictions, most notably on physical distancing and limits to the size of social gatherings. It also means that from 9th August, no venues will be legally required to close. This change is significant and it is hard-earned. The sacrifices everyone has made over the past year and a half can never be overstated. However, while this move will restore a substantial degree of normality, it is important to be clear that it does not signal the end of the pandemic or a return to life exactly as we knew it before COVID struck. Declaring freedom from or victory over this virus is, in my view, premature. The harm the virus can do, including through the impact of long COVID, shouldn't be underestimated, and its ability to mutate may yet pose us real challenges. So even as we make this move, care and caution will still be required, which is why I now want to focus on the protections and guidance that will remain in place after August 9th. Firstly, it will continue to be the law, subject to existing exemptions, that face coverings must be worn in all the same indoor settings as is the case now. We will keep this under review, but my expectation is that face coverings are likely to be mandated in law for some time to come. Second, Test and Protect will continue to contact trace positive cases. To assist with this, there will be an ongoing requirement for indoor hospitality and similar venues to collect the contact details of customers. And while, as I will set out shortly, there will be a change in the approach to self-isolation for close contacts of positive cases, anyone who is required to self-isolate will, if eligible, continue to have access to support. Thirdly, we will continue to work closely with local incident management teams on appropriate outbreak control measures, including the use of localised restrictions in future if necessary. We'll also continue to use travel restrictions as and when necessary to restrict the spread of outbreaks and protect against the risk of importation of new variants. Fourthly, we will continue to advise home working where possible for now. I know most businesses are not planning a wholesale return to the office, but recognise that a return for some staff will be beneficial to them and to employers. But it is vital that this gradual approach continues. We will also encourage employers to consider for the longer term, as indeed the Scottish Government is doing, a hybrid model of home and office working, which may, of course, have benefits beyond the need to control a virus. Fifth, while we expect to see the careful return of large-scale events, we will, for a limited period, keep in place the processes through which organisers of outdoor events of more than 5,000 and indoor events of more than 2,000 will have to apply for permission. And this is allowing us and local authorities simply to be assured of the arrangements in place to reduce the risk of large-scale gatherings. And last, but by no means least, we will continue to issue clear guidance to assist individuals and businesses to reduce the risk of transmission as much as possible. Rigorous hygiene, including regular hand washing, will continue to be essential. Good ventilation will also be important. I'll set out shortly our intention to strengthen guidance on ventilation in schools, but we'll also work across the public and private sectors to ensure an approach to improved ventilation. And even though the law will not stipulate physical distancing from Monday, we will continue to advise the public that, especially indoors, keeping a safe distance from people in other households and avoiding crowded places will minimise risk. We'll also engage with businesses and issue guidance as necessary to ensure that safe environments for staff and customers are provided and that all reasonable steps are taken to reduce the risk of outbreaks. Presiding Officer, I can also confirm that we continue to consider very carefully the possible, albeit limited, use of COVID status certification for access to certain higher risk venues in future. We are currently developing an app to make access to COVID status certificates, which will include vaccination details, easier for international travel. This will be launched next month. The app will have functionality to support the use of such certificates for domestic settings, should we decide that this is appropriate. However, I want to assure Parliament that we do not underestimate the ethical, equity and human rights issues associated with COVID status certification, and we will keep members updated and consulted on our thinking on this issue. The decisions I am confirming today reflect the fact that, principally due to vaccines, we are now in a different stage of this pandemic. Vaccination has weakened the link between case numbers and serious health harms, and that means it is no longer appropriate or necessary, and therefore not necessarily even lawful, for us to rely as heavily as we did previously on blanket rules and regulations. That's something that will be welcome for many, but a source of anxiety for some. The Chief Medical Officer will be writing to those who have been at the highest risk from COVID, who might previously have been asked to shield, to provide advice and information, and to give assurance that they too can return to a much greater degree of normality. The needs and concerns of this group will not be ignored now or in the future. I want now to turn to the changes we propose to the current rules on self-isolation to ensure that they remain reasonable and proportionate. Let me be clear at the outset that those who have symptoms of or who test positive for COVID will still be required to self-isolate as now. However, from 9th August, an adult who is identified as a close contact of someone who has tested positive will no longer be required automatically to self-isolate for 10 days. So I want to end by stressing again what all of us can do to help ensure that this next step forward is a sustainable one. The first and most important thing is to get vaccinated. If you haven't done so already, particularly if you are in these younger age groups looking forward to resuming a more normal social life, then please do so. You can register on the NHS Inform website for an appointment or by going to a drop-in centre. Second, please test yourself regularly. Free lateral flow tests are available by post through NHS Inform or collection from test sites and local pharmacies. If you test positive through one of these, or if you have symptoms of the virus, you should still self-isolate and get a PCR test. Third, stick to the rules which remain in place, for example on face coverings, and keep being sensible about the things we know can help us keep ourselves and each other safe. Meet outdoors as much as possible, especially for as long as we have reasonable weather. If you are meeting indoors, open windows. The better ventilated a room is, the safer it will be. Remember that keeping some distance from people in other households and avoiding crowded indoor places, even if no longer legally mandated, these are still sensible precautions, and continue to wash your hands and surfaces as much as possible. In short, enjoy being able to do more and meet up more. We've all waited a long time for that. But please protect yourself as you do so, principally through vaccination, and continue to take the greatest of care. If we all do that, we will increase our chances of keeping the virus under control, we will protect ourselves and our loved ones, and we will safely and securely return to the ways of life that we all value so much.
Now to the opposition party leaders, and we begin with Douglas Ross for the Scottish Conservatives. He believes the public is losing patience with the Scottish Government.
The success of Scotland and the UK's vaccination scheme means we can now look to move forward and remove almost all COVID restrictions. In advance of today's statement, my party called for the easing of restrictions to happen as planned. We highlighted the need for rules on social distancing to be removed so that businesses can get back to normal trading. We sought changes to the self-isolation rules for those who've been double vaccinated and a move towards a test-first system instead of a blanket requirement to self-isolate for 10 days. And we've argued for some time for changes to self-isolation for children in schools to prevent their learning experience from being disrupted further. For the same reason, we wanted to see the requirement for face masks in schools be removed. We've proposed these steps because the vaccine is working. It is saving lives and limiting the spread of the virus. And that's why I would urge everybody to go out and get it. We're pleased the government have listened to our suggestions. However, overall, today's statement is a mixed bag. It takes some welcome steps in the right direction, but these ongoing restrictions will hold Scotland's recovery back. When Scotland moved to level 0, some people were rightly confused because level 0 implies no restrictions, yet many restraints remained in place. We've now moved beyond level 0. Again, people would rightly assume this means that COVID restrictions have been dropped, but still curbs remain in place. Yet again, the goalposts have been moved. We're beyond level 0, at level -1 or level -2, and still the government is clinging on to large parts of people's lives. Events still have capacity constraints. The threat of local lockdowns and travel bans remain. The government seems to be U-turning on COVID status certification, home working is still being enforced, and social distancing is in a very grey area, where the legal restriction is gone, but the guidance remains in force. Clear communication is essential to maintaining public trust and compliance. There isn't much clear on many fronts in this statement. People have gone through a lot. They've sacrificed and tolerated severe constraints on their lives. They've done this with impressive dedication because it was necessary and the public health data supported those decisions. But they're losing patience with these last-minute extensions and limitations on their lives without full justification or a clear idea of what comes next. So can I ask the First Minister, are you seriously considering in the future imposing another local lockdown or introducing a travel ban where people can't leave their local area? And if so, how will that be enforced? When will the limbo on social distancing end so that all the barriers are removed? And finally, can I ask the First Minister, given the scale of Scotland's drug death crisis and the heartbreaking loss of life, even at this late hour, will she finally step up and lead her government's response this afternoon?
First Minister.
On that last point, Angela Constance, the Minister for Drugs Policy, is standing ready to make a statement on Scotland's drugs death statistics as soon as I have finished making this statement. Angela was appointed by me, as all ministers are, and she reports directly to me, and I will continue to make sure that this government addresses that challenge and takes the action necessary, and Angela will set out more on that later. Listening to Douglas Ross there, I was struggling to understand whether or not he'd listened to the same statement that I delivered to the Chamber. I spent every single day since March last year trying to deliver clear communication. I am sure I have not always succeeded. I readily concede that. Sometimes it feels as if Douglas Ross and his colleagues have spent many of these days trying to undermine the clear communication, and I got a whiff of that again today. So let me try to take him through it again. Firstly, Douglas Ross is right. The Tories have called for most of the changes I have announced today. The difference is they called for these changes to be made at a time when it would not have been safe to do so. It would have put people more at risk, and that is why we have continued to take a safe, cautious and steady pace through our exit from lockdown. I think that's right and proper, and I will continue to do that, whatever brickbats I get as a result, because as First Minister, the fundamental duty I have is to act in a way that keeps the country as safe as I possibly can. Douglas Ross called it a mixed bag of a statement. I call it sensible and cautious. It will keep people as safe as possible, and frankly, keeping the virus under control, keeping people as safe as possible is the best thing this government can do for our economic recovery as well. Most, with the exception of face coverings, most of the legal restrictions will be lifted from Monday. That's exactly what we said would happen. I don't know that many people, maybe Douglas Ross is one of them, who think that continuing to wear a face covering while this virus continues to circulate is a significant hardship. Most people I speak to, most people who contact me, not everybody obviously, but most people think that is a reasonable price to pay, not so much to keep ourselves safe, but to keep others safe, and therefore hope that others will do likewise to keep us safe. And that is part of the collective solidarity that I think most of us feel as we get through this virus. And Douglas Ross said to me, am I seriously suggesting that in the future I might impose local restrictions or travel restrictions? Well, let me say this very clearly to Douglas Ross. I fervently hope that will not be necessary. I really, really do. And I know that if we all continue to exercise the care and caution that everybody has exercised for the last year and a half, then we will minimise the risk of that being necessary. But as First Minister, and no more so than over this last year and a half, every single day, and I'm sure every leader of every government in the world will say this right now, the responsibility weighs heavily on my shoulders to keep people safe. So in direct answer to the question, if I thought action like that was necessary to restrict and curb an outbreak or spread of this virus, or perhaps a new variant of this virus that would put lives at risk and our National Health Service at risk, then no matter how difficult that would be, no matter how unpopular that might be, I would take that decision, because that's what I am elected to do, to take the tough decisions to keep people safe. And if Douglas Ross doesn't understand that, then perhaps this is not a position he should ever want to be in, because you have to be prepared to take those decisions, however much you hope these decisions will not be necessary. So this has been a cautious, sometimes too cautious for some people, careful, steady route through this. Monday is a significant, perhaps the most significant date so far, and it is positive. But I will not shy away from saying to people, I'm not going to shout freedom in this respect in any event. I'm not going to shout freedom from this virus, because I think it misleads people. The virus is circulating. The risk of new variants is there. So it is no longer proportionate to, in every respect, have legal restrictions in place, and the government has to act lawfully. But yes, of course, we will continue to advise people to be sensible, to be cautious, to follow routine mitigations that minimise that risk. And anybody who thinks that is wrong, I don't think is acting responsibly. And I will continue to try to do my duty as First Minister to the very best of my ability.
Scottish Labour leader Anas Sarwar welcomes the easing of restrictions. Amid concerns of vaccination rates, he says now is the time to take the vaccine direct to the people.
Can I start off by saying thank you to all of those that continue to work on our front line, particularly in our NHS, and to thank our vaccinators across the country who have got us to the point that we've got to today. They genuinely are heroes. And I think it's also important to recognise that people are still dying of this virus. And so my thoughts and condolences go out to all those that have lost a loved one in the last 24 hours or at any point throughout this pandemic. As the First Minister has outlined, we are now at a crucial moment in our exit from restrictions. And I want to pay tribute to our citizens across the country for the huge sacrifices they have made over the last year and a half to get us to where we are today. There is definitely light at the end of the tunnel. However, we're also at a crucial point for Scotland's recovery. It's good to see the positive improvements in the rate of cases and numbers in hospital. That is welcome. And as restrictions continue to ease, we need to ensure that people are being kept safe. That means recognising that a new period in our fight against the pandemic needs a new approach. As we move beyond level 0, it is important that we do everything to protect the freedom that people can now enjoy again. It means retooling our vaccination effort to target those places where it lags and preparing it for the next big challenge. The last few weeks have also underlined the importance of test and protect. And if increased testing is the alternative to self-isolation, then we cannot allow the resourcing of the testing and tracing system to again be neglected. But we all know how key vaccination is. We must maintain the progress and intensity of the programme. In recent weeks, the 7-day rate of vaccinations has reduced, and there are still thousands of young people awaiting their first dose, never mind their second dose. And we should be doing all we can to remove barriers to vaccination and encourage uptake. So can I ask the First Minister what plans there are to make vaccinations more accessible for those in need of a dose? For the hardest to reach, we need to take vaccination centres to the people, not people to the vaccination centres. So will we see pop-up clinics at sporting events, universities, colleges, train stations, and when will that commence? In low uptake areas, will she consider looking at door-to-door vaccinations to ensure that we increase uptake in those postcodes? And I also want to ask about ongoing support for Scotland's businesses and employers. Today's news will be welcome for many businesses, including nightclubs, that have been closed now for up to 18 months. But these businesses will not bounce back immediately. So how will the Scottish Government ensure that livelihoods are protected and Scottish businesses can continue to have confidence in their recovery? There are also now recommendations for some clinically vulnerable school-age young people to get the vaccine and a booster programme in the autumn. There is also the hope that eligibility will be extended more widely for young people. So what guarantee can the First Minister provide that all eligible 12 to 17-year-olds will receive their first dose before the return to school in less than 2 weeks? I think there does seem to be a slip in target outlined today. And what preparation work is now being done if we do get further eligibility for 12 to 17-year-olds? And finally, for booster and flu vaccine, when will individuals most at risk receive details of how the autumn booster programme will run? The JCVI interim advice suggests that should start in September. Is that looking like a reality, and will details be shared with Parliament? These questions are not just essential for keeping individuals safe, but also protecting our NHS into the winter. After so much restriction, it is only right that we move heaven and earth to protect our return to some level of normality. And again, can I thank everyone across our country for the huge sacrifices they have made and they continue to make in the face of this pandemic.
First Minister.
Thank you. These are all perfectly reasonable questions. I'll try to go through them all. I think I've noted them all down. If I miss any of the points of detail, I'll either return to them later or right afterwards. Most of them are about vaccinations, so I'll spend most of my response on that issue. I think the only thing I would take issue with in Anna Sarwar's questioning is perhaps a turn of phrase which I don't think is a reasonable one, where some young people were described as still awaiting a first dose. All over 18s have been offered a first dose. Some have not taken up that offer, but awaiting makes it sound as if they haven't been offered it. We are still and will continue to work to get uptake rates as high as possible. Uptake rates are high, higher than perhaps I might have anticipated in the younger age groups, but not as high as we want them to be. Overall, our vaccination programme is going extremely well. I think in terms of percentage of the total population, we are certainly above England and Northern Ireland on first and possibly now on second doses as well, but all 4 nations are doing well in this. But our vaccination programme is a success, and I think everybody should recognise that, because it is down to the hard work of those that Anna Sarwar rightly pays tribute to. In terms of the first question, will we have more pop-up vaccination clinics or sites? Yes is the answer to that. We're looking at all possible ways to access young people where young people are, as opposed to expecting young people to go to clinics. Now, we can't get everywhere that young people spend their time. I had a conversation this morning about, and this is just a conversation at the moment, it's not necessarily something that will definitely happen, but talking to the nighttime industry about, as nightclubs open, whether there are ways there of using that to extend vaccination to young people. So, sporting sites, places that young people go to regularly, these are all places that we are looking to get promotion of vaccine into, and where possible and practical, to actually get vaccination to or near as well. I have perhaps more scepticism, although I would never rule anything out, about door-to-door, just in terms of the labour-intensive nature of that, given that the vast majority of eligible people are vaccinated. So you would be going to a lot of effort and going to a lot of doors where everybody was vaccinated. So I've got a scepticism about whether that is the best way to go. But we, of course, don't rule anything out. We want to get to as many people as possible. On the JCVI points, yes, we are trying to get to eligible 12 to 17-year-olds as far as possible before schools go back. I said building in a bit of understandable flexibility there, given the nature of this group, that we will certainly be offering first doses by the end of August, but we want to do that as quickly as possible between now and school return. Of course, not all schools go back on the same day. Some of them go back further into August than others. As I said in my statement, we are hoping to get updated advice from the JCVI over the next day or so. I hope JCVI are our advisory body, so they have to give us the advice they think is right, and I respect that. I am hoping it will recommend going further on the vaccination of young people. I am particularly concerned, if possible, to get vaccination to 16 and 17-year-olds, which is obviously important for those who will be, for example, going to college and university and mingling with older young people who are vaccinated. But we'll see what that advice brings, but we stand ready to implement that as quickly as possible. And we wait the final position on booster vaccinations. My expectation is that there will be some form of booster programme. We're just assuming that in order to get the preparations underway, and would look to notify people as we go through the next few weeks and certainly into September. And finally, I think on businesses, the most important thing we can do for businesses is not just get them open again, and as of Monday there will be no business legally required to close under COVID regulations, but also to build the confidence of their customers to start using their services again. And that is also one of the reasons why a cautious and careful approach is required, because if people don't feel safe in venues, they will be less likely to go. And we'll be working with businesses to encourage businesses to think very carefully about the environment that they're offering for their customers as well. We will continue to consider financial support for as long as necessary, but of course we want to get businesses trading and making money again, because we don't have infinite sums of money to spend on business support. And the last thing I would again encourage the UK government to do is extend furlough for longer, so that we're not cutting that support to businesses earlier than is, I think, appropriate for many.
We return to the Chamber, where the First Minister has made the latest announcement on COVID. Most restrictions are lifted come Monday. Here's Presiding Officer Alison Johnston.
Thank you. I call Patrick Harvey.
Thank you, Presiding Officer. The First Minister, as well as Douglas Ross and Anna Sarwar, have all recognised the importance of the vaccination programme. Everybody, I think, recognises that the people who developed it and delivered it are due our immense gratitude. It has saved lives and is continuing to do so. But I think it's also recognised that vaccination is not a cure-all. It doesn't eliminate all risk. It doesn't prevent everybody from being exposed to this virus or from the risk of becoming extremely seriously ill or having their life put at risk. So I'm concerned that there is still a great deal of emphasis on this idea of COVID status certificates, so-called vaccine passports, particularly as the First Minister refers to them in relation to higher risk venues. It raises human rights implications if our ability to live our lives is dependent on our health status. It raises inequality issues if the workers in those higher risk venues are not themselves fully protected. And ultimately, can the First Minister agree, is it not the case that only direct mitigation measures to make those higher risk venues less risky is actually going to give us the protection that we need? Status certificates will not achieve that.
First Minister.
Again, I think these are perfectly reasonable questions. I've got a lot of sympathy with all of them. Firstly, Patrick Harvey is right to say that vaccines, although hugely effective and the programme is hugely successful, do not eliminate all risk and all harm from the virus. And we have never said that vaccination does that. What we do know, and I think we now have lots of evidence of this, is that they significantly weaken the link between somebody getting COVID and becoming seriously ill from COVID. Don't eliminate that risk, particularly if somebody might have other underlying health conditions, but they have weakened that, and we can see that in the still concerning but much lower level of hospital cases in this wave than we've had in previous waves. There is less certainty about the impact on transmission of the virus, but we hope it has a positive effect there. Vaccination, I don't think we can overstate the importance of vaccination and where we are now and where we hope to continue in the future, but we have to be realistic and frank about all of these things, we have to recognise the limitations as well as celebrate the enormous success. Patrick Harvey said I put a lot of emphasis on COVID status certification. If that's how it sounded, I want to try to redress that. I wasn't seeking to emphasise it or somehow pull it out as being the big next thing that we're definitely going to do. I wanted to be frank with Parliament that we are keeping our options open. So in the app we're developing, I think it's important to be frank with Parliament that there will be functionality that we are not immediately planning to use, but there will be functionality that we could use in future if we decided to do this for domestic certification, because the principal objective of the app is to make access to certificates easier for international travel. That does not mean we have taken any decisions. I am highly cautious about COVID passports, to give them the colloquial term, for all the reasons that Patrick Harvey has set out. I would be fundamentally opposed, passionately and fundamentally opposed to their use for access to public services or anything that was seen as something essential for people to access. I don't think they are a replacement for sensible mitigations, and I agree with that point. But I think there is a debate to be had about whether in some venues that are optional in terms of people's attendance at them, and where we know there is a higher risk of transmission, that we at least think about whether they could play some part in making these settings safer than they might otherwise be. There would have to be agreed exemptions in place, because there are people, as we know, who cannot get vaccinated. So I'm simply not ruling this out, because I don't think it would be responsible to do it. But I think people can hear, if they didn't hear it in my original statement, I think they can hear it now. I am far from convinced that it is a road we should go down. But I don't want to close off Parliament's options, or the government's options, or the country's options. But I do give an undertaking that we will continue not just to update Parliament, but to consult and involve Parliament as our thinking on this, or if our thinking on this develops to the point where we were proposing the introduction of COVID certification for any particular setting.
I call Liam MacArthur to be followed by Alistair Allen.
Thank you, Presiding Officer. Only a few short weeks ago, Scotland had record numbers of daily cases, amongst the highest in Europe, and Testing Protect was buckling under the pressure. Thankfully, the figures are now going in the right direction, but as we look ahead to winter, it's a chastening reminder that systems must be built and staffed to withstand whatever the virus throws at them. Like others, I also pay tribute to all those involved in the vaccine programme, but like Patrick Harvey, I'm concerned that the government is still humming and hawing about domestic vaccine passports, a full 9 months after we first pressed them for a decision. Last week, John Swinney said it would be the wrong way to handle it. Now there will be an app for our phones paving the way for vaccine passports by stealth. So why, given what the First Minister's just said, won't the government rule out domestic vaccine passports?
First Minister.
We're not planning anything by stealth. I've stood here today in front of Parliament and been frank about the options that we are leaving open, and given an undertaking to Parliament that will be full and upfront and consult Parliament in any decision. So, I'm sorry, that is not doing something by stealth. It's actually quite the opposite of that. Before I come back to vaccine passports, because it is important, and I, as I said to Patrick Harvey, and as I've said before, I am far from convinced that they are the right thing to do, but I'll explain in a moment why we're not simply ruling them out for every possibility at this stage. But before I do that, there was a first part of the question about Test and Protect. Test and Protect, as it will always do when cases are surging, came under pressure in July. It did not buckle under that pressure. It adapted and coped with that pressure, and is performing well, and I want to thank everybody in Test and Protect. The work they have done has played a part in getting us to the point where we did have some of the highest case rates, or even at one point the highest case rate in Europe, to a point where we've got a much lower case rate, and we're certainly there or thereabouts. I think Wales might still just be below us, but we've got the second lowest, maybe heading towards the lowest case rate in the UK. These trends come and go, and it's what you do to try to stop cases surging, but when they do surge, to get them under control that matters. And people working across our public health teams have done an excellent job in the last few weeks to get us into the much stronger position we are in today, as indeed has the public. Finally, Presiding Officer, why don't I just rule out vaccine passports? I won't repeat everything I've said about my scepticism and healthy degree of caution about them, because people have heard me say it. But if there's one thing I have learned, and I like to think I've learned more than one thing over these past grim, challenging, difficult 18 months for everybody, is that in the face of an infectious virus that keeps learning to run faster than us, that keeps changing itself to make the challenge ever more difficult, after 18 months of having to ask people to live their lives in the most restricted and unnatural manner imaginable, I don't think it's sensible just to rule things out for ideological or other reasons. I think you've got a duty, and I've got a duty, to properly consider every possible step we could take to get our lives back to normal and to keep them normal while protecting people from the virus. Does that mean we will do every possible step, take every possible step? No, there will be things that we do decide are not right to do, and vaccine passports in total or in part may be one of those. But I don't think it's responsible, in the face of everything we've lived through and in the face of what we're still having to deal with, to just blithely, as a politician, rule these things out. So I will continue to keep an open mind to anything that keeps this country safe while also allowing it to get back to normal.
I call Alistair Allen, to be followed by Murdo Fraser.
Presiding Officer, the cut to CalMac's passenger carrying capacity to 35%, while it was obviously done for understandable health reasons, has very seriously impacted every aspect of island life since ferry routes came under pressure at the beginning of the tourist season. Can the First Minister confirm whether passenger capacity will now be returning to something more like normality as a result of today's statement? And also, as the First Minister will be aware, visitors tend to book ferry tickets far in advance, while islanders travelling to see family, care for sick relatives or just get to work tend to need to book at much shorter notice, meaning they are at present simply unable to compete for spaces on ferries. What can be done to ensure islanders now have more equitable access to ferry bookings?
First Minister.
Okay, I thank Alistair Allen for that question, and I know the sentiments behind it will be felt very strongly by other members representing island communities. Physical distancing has restricted capacity on ferries, and that has resulted in significant problems for people travelling to and from the islands. And while that's frustrating for anybody wanting to travel to or from our islands, it is particularly difficult and has been horrendously difficult for those who live on our islands. And I understand that and want to thank people for the forbearance that they have shown. In light of today's announcement, though, around physical distancing, operators will be able to make more foot passenger capacity available from Monday, and that will ease some of the problems that Alistair Allen is talking about. There will continue to be a slightly reduced number of timetabled sailings on some routes due to the continued need for enhanced cleaning regimes, because obviously it remains important on our ferries, like in other settings, that we keep the environment as safe as possible. And regarding the essential travel needs of islanders, I can confirm that some capacity is being held back for turn-up and go travel, and in addition, islanders are also guaranteed a space on the ferry and indeed a taxi for urgent medical appointments. So this has been difficult. I hope today's announcement, operational from Monday, will lead to a significant easing of the challenges that islanders have faced.
Thank you. I call Murdo Fraser.
Thank you, Presiding Officer. I'd like to ask the First Minister more about vaccines for young people, which she alluded to earlier. There are many 17-year-olds shortly to turn 18 who will be leaving home for the first time to take up a university place within the next few weeks, who would welcome the reassurance of a vaccination that is not currently being offered to them. Given that time is very short for this group, how quickly can the Scottish Government make a decision on offering them a vaccination?
First Minister.
Well, as Murdo Fraser knows, or certainly should know, we are waiting on JCVI advice. I say we, obviously referring to the Scottish Government, but the UK Government, the Welsh Government, the Northern Irish Government are in the same position. I think I indicated from the platform behind me last week in a press briefing that the four CMOs had asked the JCVI to look again at their advice on vaccination for young people. I know our own Chief Medical Officer has also written to the JCVI. I am hoping, possibly veering towards expecting, updated advice from the JCVI literally in the next day or so, and I very much hope that that expectation will prove to be the case. I am hoping, but this is for the JCVI to advise, that they will recommend further vaccination of people in the 12 to 17-year-old age group. Assuming it is safe and the risk-benefit analysis bears this out, I would like to see us in the fullness of time be able to offer vaccination. Obviously, informed consent would determine uptake, but offer vaccination to all people in that age group. But I am particularly hopeful that we will see some updated recommendations in relation as a priority, as a first part of this, for 16 and 17-year-olds. So I am as anxious as anybody to get this. I think you can probably hear that in my voice. I'm as anxious as anybody, perhaps more than many, to get this updated advice as quickly as possible. And I'm anxious to see whether it advises what I'm hoping it does. And I will advise, I'm sure the JCVI will make its advice known in the way it chooses, but I will set out as soon as possible, depending on what that advice turns out to be, the steps that the government will take to implement it as soon as possible.
I call Jackie Bailey.
I want to ask the First Minister about long COVID clinics. I know the Scottish Government has funded research into long COVID, and a recent report from both Stirling and Robert Gordon universities recommended specialist and integrated services to deal with long COVID. England have spent 34 million on 80 specialist clinics with another 23 planned. Wales has spent 5 million on specialist clinical pathways. That's not matched in Scotland, and there is as many as 110,000 people suffering from long COVID, including children, and they are simply not getting the support and treatment they desperately need. So can I ask the First Minister, when will the Scottish Government act, provide dedicated support and treatment for people who suffer from long COVID, and will she or the Cabinet Secretary for Health agree to meet with representatives of Long COVID Scotland?
First Minister.
I'm sure the Cabinet Secretary will be happy to meet with anyone who wants to discuss these issues. I understand that he has recently met with one of our MSP colleagues from the Conservative benches to discuss these issues. Can I say we are committing significant sums of money to understanding long COVID so that we can, as quickly as possible, make sure that the right resources are in place. I'll come on to specialist clinics in a moment, but we should not lose sight of the fact that for many people suffering from long COVID, it is access to generalist services, GP and other services that they will first want to make sure that they can have, and we want people to be treated for any health conditions as accessibly and as close to home as possible. Jackie Bailey said the UK Government have dedicated £34 million to long COVID specialist clinics. I don't knock any money that's spent on these things, and the Scottish Government certainly will dedicate resource to appropriate specialist clinics in the coming period. But I simply ask people to take a step back and analyse that. £34 million in an English context is about £3 million for Scotland. You're not genuinely going to get many real clinics for that amount of money. So I would question, to the extent to which some of the headlines we hear are matched by the reality of provision. I think it's important that we do make sure we've got the right specialist provision in place, but we build that on the basis of the best understanding. Our understanding will obviously develop as our research develops, but we build that from an evidential base and that we do it properly, rather than me saying, here's £3 million, knowing that that's not going to deliver a lot of specialist clinics. We need proper investment and we need proper development of the understanding that will make sure that specialist provision does what we require it to do.
You're listening to the Week in Holyrood Summer Special. I'm Charles Fletcher. Scotland is the worst country in Europe for drug-related deaths. The latest national figures have reached 1,339 people. That's a record for the 7th year in a row. Scotland's Drugs Minister Angela Constance is pledging to make tackling drugs deaths a priority. She describes the latest figures as a national shame.
The loss of life in Scotland from drug-related deaths is as heartbreaking as it is unacceptable. It's our national shame, and I offer my condolences to all those who have lost a loved one, and my continuing commitment to do everything possible in our new national mission to turn the tide on rising drug-related deaths. On Friday, I attended a vigil in Glasgow. I talked to and heard from many people who have been directly affected by drug deaths, the very people who have been let down. Now more than ever, we need to make sure the experience of those living with problematic drug use are at the very heart of solutions going forward. That's why we're investing in local experience panels and a national collaborative of those with lived and living experience. We know drug deaths are preventable and avoidable. The publication of the 2020 drug death report on Friday was another stark reminder that the poorest communities suffer the most. That is why our national mission to save lives is linked to other work across this government to improve lives in mental health, to address poverty and inequality, to prevent adverse childhood experiences, to build resilience through education and prevention, and to bring a public health approach to our justice system. The 2020 annual report for the first time was the terrible scale of inequality between our most and least deprived communities. The power of this analysis underlines the need for better information about the problems people face, and we are making progress on this. Public Health Scotland is using a groundbreaking programme of data linkage, which will help identify where actions are most needed. The report shows wide geographic variation in drug deaths. Areas such as Glasgow, Dundee and Inverclyde are the worst affected. However, even the least affected areas in Scotland still have a greater problem in comparison to anywhere else in England. The creation of a national care service will be the biggest reform in health and care since the creation of a national health service in 1948. Ministers have agreed to consult on the remit of the national care service and whether to include alcohol and drug services in the systematic changes to the way in which people access services. In particular, we are asking whether residential rehabilitation should be commissioned on a national basis. Consultation, which opens next week, is an opportunity to consider how we can better support Scotland's most vulnerable and marginalised people, and we are committed to listening to the feedback, including those in the alcohol and drug sector. No one should underestimate the scale of the challenge we face. I certainly don't. We have made progress with other preventable deaths from alcohol, violence, some cancers, and so change is possible. But change will not always be comfortable, and I make no apologies for that. But through these changes and the actions I'm setting out today, we can improve and save lives as part of the national mission by getting more people into the protection of treatment and recovery, and this will help reduce drug deaths in Scotland. Presiding Officer, we have had the humility to accept what has been wrong, and going forward, we will have the courage to do what is right.
You're listening to the Week in Holyrood Summer Special. I'm Charles Fletcher. The Health Secretary Hamza Yousaf has reported a nursery to care watchdogs over his worries it's discriminated against his daughter. The Glasgow Pollock MSP says he was told there was no availability when his wife applied for a space for their 2-year-old daughter. He says applications submitted by friends and family for white Scottish-sounding names were accepted.
Actually, first and foremost, I would like an explanation, and I haven't had that. I just want to know why 3 applicants with Muslim and ethnic minority-sounding names were rejected, and white Scottish names, 3 applicants were accepted. I want an explanation. And if you don't have an explanation, you should be apologising for discrimination. That's what actually I want. And more than that, I want to protect my girls from discrimination. And actually, I'm gutted you asked how we felt, as well as being angry. It's gutting that I can't protect my daughter in the first 2 years of her life from discrimination. And she's going to face that right through her whole life. So yes, I will pursue this, and we will pursue this together, because we want others not to have to face the discrimination that I think my daughter has faced.
The nursery is denying allegations of discrimination, saying it would absolutely welcome a care inspectorate investigation and that it has nothing to hide. Before we go, the Prime Minister has been in Scotland this week. He had low-profile appearances and spoke to what we call a media pool. That's one journalist who covers the trip for us all. Boris Johnson was asked why he snubbed the opportunity to meet with First Minister Nicola Sturgeon during his visit.
You've declined an offer to meet the First Minister, but you have made time.
No, I haven't. I'm always delighted. Always delighted. And we seriously work together. The government of the UK, the Scottish government, at all levels work together on the things that matter to the people of our country, particularly rolling out vaccinations and generally making sure that we bounce back and build back better from the pandemic.
While Nicola Sturgeon is more dismayed than disappointed at the missed opportunity to sit down together and discuss COVID recovery.
I don't feel snubbed. I think most people will think it's a bit odd and a bit strange that we've got a Prime Minister visiting Scotland who talks a lot, rightly, about the need, despite our political differences, for us to work together where we can on getting through COVID and into COVID recovery, but doesn't take the opportunity when in Scotland to come and talk to me directly about how we might cooperate and work together. I think people will just find that strange, and it's for Boris Johnson to explain, I suppose, why this would have been the first opportunity given COVID for us to sit down appropriately, socially distanced, and have a face-to-face chat. And I think it would have been a good opportunity. I was getting ready to welcome him to Butte House today. There's lots that Boris Johnson and I fundamentally disagree on, but we both lead governments that are trying to get our countries through COVID, and so there's a lot for us to cooperate on. Missed opportunity, but that's on him. I stand ready to work with however I can to get Scotland through COVID and into recovery.
And that's the Week in Holyrood Summer Special. I'm Charles Fletcher.